All right. So thank you all for joining us. This is Greg Bloom, the lead of the Open Referral Initiative. We are here to talk about the demand-driven open data initiative that the federal government has initiated within the Department of Health and Human Services. We hope to speak with David Portnoy, who is leading that initiative. He hasn't joined us yet. He might pop in during the midst of the call. So hopefully we'll have him join us soon. But in the meantime, I'll just frame this up for the folks on the call and anybody watching, and we can see if we can hone in a little bit more on what specifically is actionable from the federal government's perspective, what we want to ask of them. And so to back up a little bit, Open Referral, working with organizations like iCarol and also organizations like the Sahana Foundation and others who we'll hear about on the call, we've developed a language for publishing directory information about health and human and social services. It's just a format that enables data to be exchanged between any kind of information system. And the federal government is in the process of publishing more useful data defined broadly. And this particular initiative, the Demand-Driven Open Data Initiative, is looking for examples of data that the federal government can make more useful by opening it up, whether that means making it more machine readable, whereas previously was in PDFs, or publishing more granular information as structured data. I think they're open to suggestions, and we're here to make those suggestions. Now, I want to frame this issue up front and then see if we can dive in. This is a very broad field. Health and Human Services really encompasses a whole wide range with many different federal agencies that provide funding of various kinds. I think for the purposes of this opportunity, we want to figure out what is an actionable set of services that the federal government's in a position to publish. What are the low-hanging fruits? Ideally, about services that are already provided by the federal government, of which that's actually not all that many. For the most part, federal government provides funding to states or contracts, and I think those lines of questioning are also valid. We should ask, how can the publication of open data about services be a condition of getting federal funding in the first place? But in the short term, if we could identify a type of service that the federal government provides that should be available in an open machine readable format, that may be a straightforward path that David can take to identifying a specific use case that can demonstrate what it is that we're talking about, that can show the value of publishing more usable, granular data from the federal government's level. And the kinds of value that we've identified so far, first of all, entail potentially making it easier for organizations that provide referrals to keep track of this information, spend less time calling federal agencies over and over again to get updates that could easily be published directly to their information system. That's potentially good for the federal agencies in terms of reducing the number of organizations that are calling them asking for this information over and over again. It also potentially sets up other kinds of benefits. We could imagine a future in which the federal government's publishing machine-readable, uniquely identified data about the services that it provides and funds, and a wide range of referral providers are able to read that information and then submit even traffic, sort of share feedback about the quality of the services or the accuracy of the information. Moving towards interoperability has all kinds of potential benefits. And so our challenge here is to identify a specific use case that we can ask for David's help in pursuing and set ourselves up to test whatever he comes up with. And to put just one more fine point on it, the open referral format, specifically the human services data specification, represents over a year of participatory research from participants in the Open Referral Initiative from across the country. It really has a wide range of perspectives that reflect the most essential fields of information that referral providers use when they're connecting people to services. So we're using that as our baseline point of reference when making suggestions to the federal government as to what kinds of information should they publish and how should they structure that. So we're not just saying, federal government, you should adopt the open referral data standard. It's not quite that message. It's much more, here's a set of fields that reflect the general practice across the country in various domains, and we want to help you start here, publishing these types of information, but we want to check our assumptions along the way. We might discover that there are important fields that we haven't identified in the spec. We might also discover that there's something about the spec that should change in the future. So we are being flexible, even though we do have that initial starting point in terms of what kinds of information are we hoping the federal government will publish. So I'll pause there, see if there are any questions for me about any of this, and then from here, I think we can talk about the range of possible services, discuss the criteria for like what would potential first go use case look like, and then see if we can come out of a brief conversation with homework for David, who hasn't been able to join us so far in this conversation. So I'll pause first for questions. Any clarifying questions or suggestions right off the bat? Hearing none. Everybody sounds good to everybody? Okay. Okay, so I can jump right into talking about the specific kinds of federal services and federally funded services that we've identified so far, and we can think through like what would be useful to start with.
Sounds good.
So right off the bat, when we've polled the community in the past very unscientifically, when I've asked people, especially 211 providers, what kinds of services does the federal government provide that are important to you? When I've asked, the most common answer to that question is actually Veterans Administration facilities and services, the VA. People say that it's very difficult to keep track of which VA clinics are where, and more importantly, what services do they provide. And when we've taken a look at the data assets at the VA, we see things like, they'll have the name of the facility and the address and maybe a contact, but they won't have any structured information about like what are the services provided at this facility and how do you access those services, which is actually, that's the information that users would really need. So that's one obvious example of a really important subdomain of services that the federal government directly provides. It's doesn't fall within HHS, but it may be something that David could help with, so we certainly identified it. And another example is Social Security Administration, simply identifying the local facilities of SSA and information about what programs are offered there or what the services are there. Beyond those two, I often I don't get many answers from people about what are the services that the federal government provides itself. That said, when we asked, I did ask Carol, and I hope I hope it's all right to share this. When Carol and I were talking about this, she actually was able to pull a set of federal agencies that are listed in her resource directory database, and she's an iCarol user, and so I've listed these agencies here in this Google Doc in the last page or two. She got hits for the USDA, housing and community facilities programs, business and cooperative programs. She had hits for HRSA, Health Resources and Services Administration. I think those are like rural health clinics. DHS has, she had entries for disaster services, and FEMA. HUD seems to offer services directly in terms of affordable apartment searches and energy and housing. And there's actually a whole set of subtypes within the VA. And even the IRS, it seems like, offers financial and income-based services. So I would love to. First of all, I'd love to expand this list. If anybody else is like, well, this is a service that some federal agency provides that's actually useful to our community, we can identify that. So we want to expand this list, but then also we want to contract it once we have what we think is like these are federal services, and hone in on stuff that is like actually really valuable, and B, potentially actionable. And ideally, I think actionable data might look like something that already exists on some sort of federal data portal, but could be restructured helpfully along the lines that we suggested. And if we can identify even just a couple of those, it's a very straightforward ask to the federal government to say, please make the data about your own services more specifically usable. So. Thoughts, questions, suggestions, anything pop out as especially important on this list, or anything that you suspect is missing? I'm going to read while you all think about what you think. Carol just shared something. To start with, one record might be one approach, in which case HHS's HIPAA complaint line. The HIPAA complaint line. And Carol, that wasn't, I don't see that listed in the base, but I can list it here. Does anybody have a link to the HIPAA complaint line and anything about existing information there? She says it's in the 211 Lifeline information system. Okay, we've got a URL here. So this is a good example, I think, and I think I even want to check my own assumption here. We can look at this URL that Carol just shared in our chat bar, hhs.gov/OCR/HIPAA. And the question is, would it actually be useful if, in addition to this website, the federal government, HHS, published a data package that had this website's information listed as part of the broader model of, HHS is the organization that provides this service of the HIPAA complaint line at this site, which is this URL. Would that be useful potentially to referral providers like iCarol, or to software systems like Sahana? Thoughts?
Yeah, I mean, Greg, just generally the availability of well-structured data on federal government services definitely very enticing. I know you and I have talked about this and you're aware of this, but for the others' benefit, to have consistency in how it's structured would be a big win, because trying to support 53 different data structures for 53 different data feeds would be prohibitive. And if it's one data structure for 53 feeds, that gets a lot more interesting.
Yeah.
So FEMA, has a lot of disaster data. In the U.S. in New York during Sandy, when kind of the state and the local nonprofit community dropped the ball on managing referral data for services for victims of the storm, it was a FEMA team that basically created a giant PDF of all the services that were available, and that's what was cycled through the system, cycled to kind of all the case managers for almost 2 years. So I think there's, an opportunity there, beyond, I think that, all this stuff is tough when you don't have a really clear market, that's defined. So I mean, I think that there's FEMA could be an entity that really demands a services standard. You start getting into the whole disaster landscape, and then you get into federally regulated case management systems like CAN, which is produced by the Red Cross, and they have service directories. That's a VisionLink product, and so the ability for FEMA and VisionLink to exchange data, in like a CAN environment is probably something that people would be interested in.
Yeah, I mean, I think that's all really, it is pretty interesting. I think it sounds like you're thinking on a higher level in terms of the information systems used by a federal agency like FEMA and how effectively those information systems, publish data for use in other information systems. Which I think is also a really important conversation. In David's case, I think he has the ability to pursue very specific data sets. Like he can call up the people at some federal agency who should be publishing this data and say, can I help you publish that more usefully?
Well, I think there's a, I've read a bit of David's work. I mean, I think there's a general need for, people in the federal government don't know what open data is. And so I think there's an education opportunity within like the disaster management community, within FEMA, to kind of explain what the opportunities are. I mean, there's tons of FEMA-specific data that exists around like how to access case management services and how to get loans and things like that. Mm-hmm. The question is who's in a position to deliver that data to end users, and I think the answer to that would be, there's FEMA's website which is a big resource, but from an automated perspective, that would be CAN.
Devin, would you be able to point to sort of like evergreen services that are listed on FEMA's, like that FEMA provides, even something that's just like this is a website? If you would be able to point to like even just one or two in terms of like this is a service that FEMA provides to the public, we could serve that up to David as an example of something that he might want to look into. I think our message is, a website is great, but it would be even better if every referral provider in the country could consume a data package that would bring into their system the information that website exists, and that might be useful to somebody in that circumstance.
Yeah, I mean, it's probably doable. I mean, FEMA doesn't produce tons of evergreen services, and they have basic preparedness stuff.
Yeah, I think we don't need tons. We just need a couple. We just need to be able to focus our advocacy on something that's very specific that he can pursue and sort of like come up with something that we can test. And I think that actually on that point, the second question is, we want to make sure that what we're asking him is something that, like, if he published this data package according to the open referral specification, more or less, that you all as in Carol, Sahana, that what we're asking him is close to what we think you all would be able to simply like consume. And I think there's a bunch of open questions. We don't have to figure everything out in advance. We just want to sort of position this that we're setting this up to succeed. And right now, the ask is publish these fields and this, and a bunch of CSVs with this JSON data package. But frankly, if it's just like, if he just gets the field names and, he doesn't quite get the bundle of CSVs with the JSON data package, I think there's a question of whether that is something you all can work with and test out anyways. While that question is floating in the air, Carol has been sharing some more insight in the chat box. I'll just read it here. She says FEMA services are pretty specific. Local agencies provided most of the services in, like, after Sandy. So she observes that I think this conversation is also especially relevant for state-level services. And I agree. I think if we're able to set a precedent at the federal government, a lot of the value of this approach very well may be state by state or even local municipal governments. Carol suggests small business assistance or individual assistance, but it's specific to an event and not an ongoing service. And she also suggests that HUD would be worth looking at, if not HHS. So yeah, I mean, I think HHS is where David is coming from. So if we are able to identify even a couple of services within their domain that they provide directly, that may be the most expedient for him to address. But he did suggest that he could pursue data in other agencies' world. So I also realized I didn't actually allow y'all, like, I didn't give you the opportunity to introduce yourselves. So how about this? Since we might be like wrapping up, we might be approaching a point where we have at least a couple of bullets to hand over to David. Let me go through and have you all introduce yourself and sort of share a question or a suggestion about this opportunity, and then we'll sort of assess, what's on people's minds at this point in time, and see if we can wrap up from there. How's that sound?
Who goes first?
David Mokler, we haven't heard from you, so let's go ahead and introduce yourself and express a little bit about your interest for this particular topic, and any questions or suggestions you might have.
Okay, first verify, can you hear me okay?
Oh yeah.
Okay, good. I'm a service provider, and more specifically a publisher of numerous helplines that are nationwide in scope. If you've ever gone into an employee break room, you've probably seen one of my posters which lists financial assistance for employees, and that's just one of our free products. But we built a switch that routes calls directly to local providers based on a caller's origin. And so those types of helplines typically are financial assistance of one sort or another. And so my interest in what you guys are doing, and I applaud it, is to try to, from a service provider standpoint, maybe help you guys steer towards helping groups like us who always have to respond to update requests from countless 211s in their siloed situation there. And so what we would love to see one day would be where I would upload all of our helplines, all of our information, and it would populate throughout the country to all of these 211s and many of the other groups. But to get to today's topic and my suggestion, I think I'm not positive of which of these would be specifically currently government services, but certainly things with an upward trend would include ID theft recovery. One of our most fastest growing helplines happens to be that type of help. It's not news that more and more ID theft is happening, and unless we can really get behind this, it's only going to get worse. So something like that, if you wanted to ask David about what resources that they can bring to bear on that. And the other obvious upswing is student loan relief. The mounting debt with student loan debt is now reached $1 trillion. So that's obviously an urgency. It may not be as urgent as disaster relief like Sandy, but I would suggest maybe we look at that in the Department of Education and their website information. A lot of callers are just not getting to where they need to go for free government help. And by the way, my group is called careconnectusa.org if you have any further questions or inquiries.
That's great, David. So first of all, thank you for very specific bullets that we can sort of share to David Portnoy as examples of particular services that we might want to try to make available in a machine-readable format. And also, it sounds like Care Connect USA very well may be a great source of information for 211s. So we should follow up with conversations soon about how we can help you publish your data about your helplines in a machine-readable format. Thank you. Carol has shared some more in the chat box. She says, let's see. So Carol's the director of a small 211 in the Finger Lakes region of New York State, and she's interested in reducing duplication of effort and thereby reducing costs and or increasing the scope of what they can do with the same resources. Carol, if you have any questions or suggestions based on what we've talked about so far, please let me know. Neil, let's have Neil and then Devin. Any final questions or suggestions? I think we already have at least a few bullets that I can bring back to David, and we have this, he can see people face to face talking about the issue with this video. So hopefully he can get started. But any questions to move the conversation forward?
Well, my question would revolve around is there an inventory of health and human services data that we could surface and review? If David is interested in advancing this, I would expect we'd want to go after initially some higher value targets, if you will, and then get a critical mass. So rather than try to conquer the world, we can certainly take a look at that inventory and say, all right, let's go after these three and get them moving and do it as a proof of concept. So that would be my question. I would just add, Greg, by way of introductions for David, if you are listening. So my software, iCarol, actually, and that of my firm, now is present in over a third of all the 211s in North America and over a half of all the crisis centers in North America. So starting there, you've got quite a representation of frontline mental health and crisis workers helping people in the public. So your audience for this data is quite large, even if it were just to go through iCarol, let alone all the other folks participating in this call.
Which suggests that, David Moakler, we very well may have found a use case for the value proposition, even not from the federal government, on this call. We should follow up and see if we can get you expressing your data in this format and see if Neil at iCarol is able to consume it. And if so, right there's an immediate win of about a third of the 211s and half the call centers, and we would be able to use that as a springboard to promoting that use case throughout the rest of the sector.
Yep, good point.
Wonderful.
Devin, final thoughts to close us out?
I'm the president of the Sana Software Foundation, which produces the world's most popular open source humanitarian aid management system. And I mean, in the world of humanitarian aid, basically we produce commodity software that enables like aid management to take place, in like a wide variety of contexts. I don't feel like I'm sure we all we understand the value of open data within kind of various facets, particularly in the services challenge. But data of all types is really useful. The feds have, I think a lot of us are disappointed in data.gov and kind of where that went. And there's a lot of, I think, groups like us, like open source software providers that want to be able to spin up systems and put a lot of data in them, quickly and inexpensively. And so, services data is great data for that.
Awesome. Okay, here's what I'm going to do. I was actually the one trying to drag David so that we could get face-to-face with him, but he's like, I think, ready to get to work. He just needed to actually hear from users like Devin and Neil and Carol, some specifically, what is it that they want to do. So he very well may need some more specifics in terms of like before he gives anybody any assignments. It'll be useful to be able to point to the reasons for certain things. So that may come up. But what we'll do is sort of form an ad hoc working group around this and try to minimize the amount of time that we have to get face-to-face. And hopefully the next time we get together to discuss this particular topic, hopefully he'll actually already have tried something, and we'll be able to then talk very specifically about what worked and what didn't. And I know that there's at least 4 or so other groups who are interested in testing whatever it is that he comes out with. So it won't just be the folks on this call, but this alone I think is going to be really useful in setting him to work, even though he wasn't able to join us today. So any final thoughts, please share now. Otherwise, I will let us off early. Cool. Great. All right, I'm going to cut it. I will look forward to seeing you all in other contexts elsewhere. Be in touch soon. Thanks.
Adios. Thank you.